Hello, thank you for being here today. We're looking forward to this press conference. Appreciate all of you being here. I'm honored to introduce to the stage Deputy Secretary Jim O'Neill.
Thank you, Stephanie. HHS is honored to host today our friends in the Department of Justice. We look forward to collaborating with you over the next 4 years to make America healthy again. We're also honored to welcome Senator Mullin, who has been a wonderful friend of this department from the Health Committee. I've had the pleasure of working with many people on the frontier of innovation. Innovation in healthcare, innovation in government, innovation in business, working to make things better. But not all innovation is positive. Dark innovations in chemistry have exacerbated the addiction crisis in this country. Synthetic opioids like carfentanil, and the substance we're here to take action on today, 7-hydroxymetragenine. 7-OH carries substances are often sold online or in convenience stores with no quality control, no dosage control, and no warnings. This is a recipe for public health disaster. Young people, veterans, and people who suffer from chronic pain or addiction are being misled into thinking that these are safe alternatives. They're not. Here at HHS, we're committed to gold standard science, safety, and compassion. We know people are looking for relief, but that relief must be grounded in reality. We owe it to the American people to act decisively, and that's what we're doing today, initiating a process to schedule 7-OH as an illicit substance. To share more, I'd like to welcome to the stage my good friend and colleague, the Commissioner of Food and Drugs, Dr. Marty Makary.
Thank you, Deputy Secretary O'Neill. It's great to be here. 7-OH is not just like an opioid. It does not just have opioid binding properties. 7-OH binds to the mu receptor, which means scientifically, by definition, it is an opioid. And yet it is sold in vape stores, in smoke shops, in convenience stores, in gas stations, that are popping up all over the United States, and nobody knows what it is. It is a synthetic concentrated byproduct of Kratom. Our focus is not on Kratom. Our focus is on 7-OH, which, according to the Journal of Medical Chemistry, is 13 times more potent than morphine. We have a history in public health of being asleep at the wheel. 30 years after cigarettes were widely used, then we started raising public health concerns. After heroin, crack, cocaine, and other street drugs became popular, about 10 years later, the medical establishment and public health community responded. 18 years after the approval of OxyContin by the FDA, we woke up to a terrible crisis that may have killed almost 1 million Americans. And then again, right afterwards, with fentanyl. We have a history of being asleep at the wheel. For the sake of our nation's children, let's not get caught flat-footed again. Public health is supposed to prevent disasters, not just clean them up after they killed thousands and thousands of people. Why do we get caught flat-footed time and time again? In my opinion, it's because of a disconnect between the ivory towers and the streets. Have experts been to the vape stores? It affects what we see in the operating room. I learned from living and working in inner-city Baltimore that you have to be proximate to a problem to understand it. We can't just talk about it on panels at medical conferences and in the ivory towers of the medical establishment. I saw on the streets of Baltimore how some of my patients that I would bump into switched from the prescription opioid that I would prescribe to heroin because they couldn't afford the copay. I've been surprised going to these vape stores at what I'm seeing. First of all, roughly 85% of the vape products are illegal vape products. We know that because the FDA publishes a list of legal vape products, and no cutesy, fruity flavor designed to appeal to children or a video game vape product device is legal or approved by the FDA. I've been surprised that the candies and gummies and drinks and ice cream cones, here's one drink with 7-OH in it. There are other products that get added to drinks. Do we understand what 7-OH is at public health scale? Let's not get caught flat-footed again. We're not targeting the kratom leaf or ground-up kratom. We are targeting the concentrated synthetic byproduct that is an opioid. The Trump administration is deeply committed to preventing another wave of the opioid epidemic. And this is deeply personal for many people. It's deeply personal for the Secretary of Health and Human Services, who will share how at a young age he struggled with addiction. It's personal for a family friend, a good family with a good kid who is addicted, knows they're addicted, wants to stop their addiction, but can't stop. That story is going on all across the United States, and we don't have research or numbers or statistics on the scale of that problem. Let's not allow another wave of the opioid epidemic to catch us blindsided again. I've met some of these families. Let's be honest, there's also a lot we don't know. This may be the calm before the storm. It may be the tip of the iceberg, but let's be aggressive and proactive. Today, the FDA is announcing that we are initiating action to recommend scheduling of 7-OH as a controlled substance by the DEA. We are also releasing a report on 7-OH to educate the public, including the other names it goes by. And finally, we need to educate the public, including the medical community. I've talked to many doctors who don't know what 7-OH is. We need to be proactive so we don't get caught blindsided again. Thank you very much. Now I'd like to introduce DEA Assistant Administrator Tom Pervoznik. Tom, if you could come up here. He leads the Diversion Control Program Office, and he's worked with HHS to uncover billions in healthcare fraud. Thank you, Tom.
Good morning, and thank you all for being here. Let me start by saying DEA's mission is to protect the public health and safety, period. That means taking action when dangerous, unregulated substances threaten American lives. DEA just received the Department of Health and Human Services formal recommendation for 7-hydroxide mitragynine, and now that we have it, we'll review it expeditiously, thoroughly, and in accordance with the law. We don't play politics with science, and we don't cut corners when it comes to public safety. DEA is the agency charged with making the final scheduling decisions under the Controlled Substances Act. But we don't act alone. We rely on HHS and the FDA to conduct rigorous, science-based evaluations, including the 8-factor analysis that considers abuse potential, medical use, and public health risks. DEA will now begin the legal rulemaking process, which includes an opportunity for the public to comment before any final scheduling decision is made. That means full transparency, and all voices will be heard. DEA will do what we've always done: follow science, follow the law, and do what's right to keep our communities safe. Thank you.
Thank you, Tom. One of the dangerous things about 7-OH is how much confusion it can cause. Many 7-OH products are marketed as kratom extracts or enhanced kratom. But in reality, they are the concentrated synthetic potent form that is an opioid. Our next speaker, Melody Wolf. Melody, come on up here. has experienced suffering looking for pain relief, and she's going to share a bit about her story and how the dangerous 7-OH product affected her life. Thank you, Melody.
So very good to be here today. My name is Melody Wolf, and I'm from Kalamazoo, Michigan. I have 3 grown children, and I'm going to be celebrating my 39th wedding anniversary on July 31st. So I'm very happy to get to do this and have my family see me doing this today. I'm also a 20-year chronic pain patient. I spent 8 of those years in bed. Our home was a pretty dismal place. My kids had fans on in their rooms at night because they needed to sleep and they couldn't hear me crying in the downstairs. They were able to go to very few activities because I was bedridden. And they had no parent to take them. My husband was working, and so we missed out on a lot of activities that they should have been at. And to be quite truthful, my marriage was headed for a divorce. But remember, I'm celebrating my 39th wedding anniversary soon. I saw many doctors at the Cleveland Clinic, the University of Michigan Rheumatology, and so many specialists. I was taking up to 11 medications at one time from one doctor, and one of them being the highest patch count for fentanyl. It didn't really help my pain. It made it easier to take because it made me sleep a lot, it made me groggy, but you know what? It also made me mean. And like I said, our house was a dismal place, and I'm just so thankful that I found a botanical called Kratom. And right away, my life improved. I was out of bed, I was doing activities with my kids, and I lost a lot of weight too. Being in bed for 8 years, it affects your health very negatively. So I got my life back. I've taken tent camping trips to both eclipses, and things just turned around for my family. And in 2022, during COVID time, my daughter and son-in-law lost their child care. I got a call. Mom, would you like to come move in with us for the year? I said yes immediately. Don't you have to ask Dad? No. So it was very, very thrilling for me to get to spend the entire year with my granddaughter. And it was Kratom only, the powdered leaf, that saved my life. And now I'm seeing something very dangerous happen. 7-OH is being sold over the counter. And it is not the plant. It's a concentrated substance that is very dangerous to consumers. 7-OH is not what helped me get out of bed and get a quality of life again that I enjoy. I check out my smoke shops to make sure that they're selling products appropriately, that there's labeling on them, that they have a no minors, and that Kratom is behind the counter locked up. I did that on Sunday. I said, where are your Kratom products? He said, oh, here they are. He handed me a 7-OH product. And I said, that's not Kratom. And he was very confused. He said, it's not. I thought it was. I said, no, it's not. I briefly explained it to him. And then when I told him that I do not take 7-OH, I never would, he said, well, I'm very glad to hear that, because many of my customers tell them that it takes them back to their heroin days. And there is the big danger. So this is what's happening. 7-OH is pulling people away from the opioid use that they've been trying to get away from. 7-OH needs to be off of the shelves. Thank you.
Thank you, Melody. Now we're going to hear from Senator Markwayne Mullin from Oklahoma, and he has been a champion in Congress on addressing the opioid epidemic. And so, Senator Mullin, great to have you here, and thanks for speaking.
Thank you.
Great.
Thank you, sir. Appreciate it. You know, we all get involved in issues for purposes of either passion or personal experiences. And with the opioid crisis or the drug epidemic we've had throughout the country, it's affected almost all of us. either directly or indirectly. For us, my wife and I, it's affected us directly. Unfortunately, we have family members that we love and we want to take care of. And if you've ever dealt with a family member that is struggling with drug use and you're the caregiver of that individual, they go missing for days. And you're worried about your phone ringing. You're afraid to be away from your phone. The phone rings at 2 o'clock in the morning, you pick it up because you're afraid to hear what you're worried about 24/7 is they found him dead. And typically it's, hey, I got arrested, I got in a fight, I'm in trouble, got stabbed, can you come get me? And the list goes on. And I could give you horror stories of all the phone calls that my wife and I received over the last 20 years. And then when someone goes and they go to rehab and you get out, and because my Lord, we've been to every rehab center you can imagine, and I'm sure some of you guys have experienced the same thing. And they're clean, they're doing better, and they find out they can go to a gas station or a vape shop or a skate shop or a bike shop, and they can find something that's legal for them to take that gives them the same high, and they can still pass drug tests even though they're on probation, and yet it's a road to the same addiction. And you see the pattern, you see it in their face, you see it in their eyes, you see it in their words, you see it in their behavior, and you're going, oh my gosh, here we go again. And you go get them drug tests and they're passed, and you're going, what is going on? How can they pass this? What are you doing? I'm not doing anything. I'm not doing anything illegal. But you can read it because you've been with that loved one so long, you see it. And you're helpless. And once again, you know where the road is headed. And then honestly, those of our family members that we've struggled with addiction, when they actually get put in prison, it's probably the first night you actually sleep well. Because you know where they're at. You know you're not going to get that phone call. You don't like it, but you can breathe for the first time. And in our case, a person gets out after years in prison, and they find it in a drugstore again. And these individuals that are selling it know what they're doing. They know the individuals they're targeting. They know the loophole and selling it as a dietary substance. Well, they probably do lose weight, but not for the purpose that we would like them to. And now that industry has grown from nothing to over a $9 billion industry. More than even opioids that are selling on the street, which is at $5 billion a day. Because they justify it. It's legal. But it's an addiction that's ruining lives. It's an addiction that's truly killing people because it leads them down a road that sometimes they'll never recover from. And we've known this. And for the first time, we have a secretary that not only has a backbone to do something about it, but he does it because he has personal experience. He understands addiction better than probably any of us in this room. And it takes somebody like that understands the danger that this causes to stand up and push against this, I say, illegal industry, because they're using every loophole they possibly can. And once again, selling it as an energy drink or a dietary, but yet the packages look like it came off the shelf of a cereal box or a candy bar or one of their favorite Mountain Dew drinks. The list goes on. They know who they're targeting. And so, Secretary Kennedy, thank you for standing up and actually doing something about this. Because this isn't anything new. This has been around for years. But without your leadership, this would never happen. So, from my family and every single family that has dealt with this, God bless you and thank you.
Thank you very much. Thank you for those kind words. Markwayne. Thank you to Jim O'Neill, to Tom Brzoznik, to Marty Makary, and to Wendy as well. Thank you for that, for sharing your story. I spent 14 years a heroin addict, and I've been 43 years in recovery. And so I spent a lot of time talking about addiction and reading about it. And typically in most societies, you have about 10% of the population that suffers from addiction. But when there's availability, that can become a crisis. And you can have, for example, in Yemen, virtually 100% of the adult population is addicted to khat, because it's available on every corner. And my addiction started because of, let me say this, it was precipitated by availability. In April of 1968, 3 months before my dad died, the French Connection, the biggest heroin bust in history, heroin recovery, happened all together. They got out of one automobile 200 pounds of heroin, of pure heroin, and they ended up getting, I think, about 1,600 pounds over time. That heroin was then stolen from the evidence locker room in the Manhattan DA's office, and it was distributed on the streets of New York. And for several years, there was $2 heroin, so it was available in deuces. And there were people on every corner in Harlem, every corner in the Lower East Side, who were selling $2 heroin. And 72nd Street in Central Park, there were over 100 dealers selling it at that time. And, you know, I had iron willpower in other parts of my life. I gave up candy for Lent when I was 13. I never ate candy again until I was in college. I gave up desserts for Lent the following year, and I never had another dessert till I was playing sports in college and trying to bulk up for sports. I felt I could do anything with my willpower, but this compulsion was absolutely impervious to my will. And part of the problem was just the availability. It was too easy to get this drug for me. And if you look at the waves of addiction that Marty talked about throughout history, they're all precipitated by availability. Morphine was invented in 1803, and during the 1880s and 1890s, there was an addiction crisis in this country. One, because of the availability of opium that was coming in through immigrant supply chains, and the other was there was a lot of Civil War veterans who had become addicted, and it was widely available. Cocaine was available in medicinal drinks and in popular drinks like Coca-Cola. And Congress, in response to that crisis, made heroin and cocaine illegal in 1914. And we had a break from it for many, many years. And then the drug culture began in the 1960s, where it was psychedelics, et cetera. But the real addiction crisis began after 1969, when that heroin became available. And you got a whole generation that was hooked on that. And then in 1970, Congress again acted to criminalize heroin possession. And we got a little bit of freedom until the 1980s, when there was the drug cartels in Mexico and elsewhere developed supply lanes through the Bahamas and Mexico that the DEA was not ready for at that time. There were huge surpluses of cocaine in our country, and the drug dealers figured out a way to market it very cheaply through a new form of cocaine called crack. And throughout the 80s and 90s, we had the crack crisis in our country because of the availability. And then in 2000, we had the oxycodone crisis because suddenly opiate pills were available, partly because of the agency capture at FDA that Marty is now dismantling. And with that, FDA's action abetted that crisis. And so when we have that availability, it turns into a national crisis. And we're still losing 80,000 kids a year. 3 years ago, we lost 106,000 kids to addiction. That's double the number of children that died, of American kids who died during the 20-year Vietnam War. It's 2 Vietnam Wars worth of casualties a year from this crisis. And as Markwayne said, all of us are touched. President Trump is touched. His family also suffered from addiction. My family, I lost a brother to this disease. I lost a niece during COVID, a niece who I raised in my house, who was like a daughter to me. I lost another niece to injuries, who's now a quadriplegic because of this disease. But all of our families are touched, every American family. The financial cost to our country is in the trillions. And what we're determined to do is to avert a 4th wave of addiction. You know, I became an addict because it was so available, but I still had to go to Harlem, or I had to go to the South Bronx, or I had to go to the Lower East Side. And now you can go to any gas station. And the people who are marketing these drugs, we were met at with Pam Bondi yesterday, talking about this issue, and with these people from the DEA, and they showed us maps of the places where the vape shops and the smoke shops where this stuff is being sold, and they're around military reservations in our country, and there's, you know, the DEA has done measurements of urine in our troops, and they're skyrocket. The more it's directly correlated to the number of vape shops in their area. They're putting them around schools, they're putting them in our poorest neighborhoods, and now they're putting them in every gas station. And they're marketed for children. They're gummy bears. They're bright colors. They're candy flavored. This is really a sinister, sinister industry. As Marty pointed out, our agencies have been asleep at the wheel for all of these other crises. And now we're going to wake up and we're going to stop this before it starts. So I want to thank all of these ladies and gentlemen for their commitment to making sure that this does not happen again in our country and averting the 4th wave of addiction. Thank you very much.
Thank you, Secretary Kennedy. We're now going to take questions from the press. If you can please keep your questions to the reason we're here today, and also give your first name, last name, and outlet. We have a microphone for you.
David Lim with Politico. Thanks for taking my question. In 2018, former FDA Commissioner Scott Gottlieb said FDA scientists conducted an analysis suggesting that kratom compounds had opioid-like properties. And he said that there is, quote, no evidence to indicate kratom is safe or effective for any medical use. I know the FDA's warning letters and the actions today are concentrated on concentrated 7-OH products, but does the government today believe kratom itself is safe to consume? And then secondly, the DEA previously attempted to temporarily schedule 7-OH in 2016 before backing off after receiving public blowback. Is the Trump administration prepared to finalize the scheduling process, even if it receives similar concern now?
So, first of all, we're not prepared to say anything is 100% safe, especially when it has psychoactive properties. But what we are saying is that our focus is on synthetic concentrated kratom. And you point out a good point, and that is that if we talk about all 7-OH, then we're not distinguishing to the public the risk stratification of the synthetic concentrated from the trace amounts of 7-OH that naturally appear in the kratom leaf and have for centuries and have been used in teas and other things. So our scheduling recommendation will delineate trace amounts from synthetic concentrated amounts. Great question. Thank you.
Hi, Lizzie Lawrence, reporter with STAT. I'm curious how many, if there are any known cases there are of 7-OH being recorded as the sole cause of a fatal overdose?
We have terrible statistics because if somebody comes in with 7-OH overdose, I'm not even sure a doctor would know to ask about 7-OH. Very few doctors I've spoken with know what's in these vape stores or know what 7-OH is. I've had to explain it to the dozen or so doctors I've talked to. So I think we're just starting to understand. It's very, very reminiscent of when we prescribed opioids to patients who didn't need them after minor surgical procedures, or too many opioids for those who did need an opioid. And we would notice some people were coming back for refills at a very high rate, but we hadn't put the two together because we hadn't recognized the addictive nature. So we need better statistics. There is a commitment from NIH to do some research to try to understand this, but this is not something where, after 50,000 Americans have died from it, we want to start that process. Thank you, Lizzie.
Hi, Sarah Overmall, CNN. To David's question, what kind of regulation and guidance or scientific evaluation could we see in the future about natural kratom?
Look, I think there have been physicians who have had concerns about some claims around natural kratom. We have to prioritize what we work on. So we are going after the killer first, which is the synthetic concentrated kratom, and then we can look into that other question. But we think it's night and day in terms of the public health risk. Thank you.
Hey, thank you. I'm Scott with CBS. You mentioned the doctors need to become more familiar with the danger here, and you've issued a letter, I think, today to doctors. But what, in fact, changes today? I'm sorry, are you issuing a new regulation? Are you going to do the scheduling? What actual change is HHS affecting today?
Yeah, so great question. Thank you for that. So a couple things. One, we're issuing a report, an FDA report on 7-OH, explaining it. We are putting that out there. We are, and we'd love for you to let Americans know about that report so they can learn. It has both a deep science component and a section for lay people so they can understand the issue. We think every school board should be talking about this. We are, number two, issuing a letter today to the DEA to recommend scheduling above a concentration threshold as a controlled substance. Number three, we are sending a Dear Doctor letter to every physician in the United States warning them about this. And we're going to continue to try to educate the public. So a couple very definitive actions today, and of course we announced a couple weeks ago that we have let distributors to the retail stores know that we have serious safety concerns and specified those concerns. Yeah.
Hi, Margaret Manta with Notice. You said that you're thinking about this in terms of concentration, where it's like trace amounts of 7-OH and kratom versus, the much more concentrated product. Is this a framework that you think the FDA could use for other dietary supplements?
I think it's a good idea. Thank you for suggesting it. We do something called an 8-factor analysis. So our scientific team and the scientific team at the DEA independently try to evaluate, is there a threshold? And they look at animal studies and a whole bunch of other criteria to look at dependence and addictive thresholds. So we have a threshold that is calculated in 2 different mathematical ways to try to distinguish what we're talking about with concentrated kratom from the trace amounts that appear in the kratom leaf. Thank you.
Thank you, Katrin Asaf, Gray Media. I know you said this process is just beginning, but of course that takes time. So in the meantime, can you tell us how quickly can we see these products removed from shelves or at least made harder to obtain? And then what message do you want to give to Americans who are seeing this and saying, oh, I thought it was totally safe and maybe still today can actually go and get it?
So effective immediately, the letters are out to the distributors, and we've actually gotten some positive feedback from some of those distributors. So we're sounding the alarm with the distributors of the synthetic concentrated kratom. We also want to create a national conversation where parents talk to their children. Kids are sometimes using these substances and the parents don't know. And sometimes the kids are using it and they don't actually know what's in these substances. So this is a time, as with other new addictive substances that enter the United States, for us to have these conversations. And I hope school boards, places of worship, all talk about the illegal substances in these vape and smoke shops and gas stations. Thank you.
Hi, Liz White with the Wall Street Journal. Also very present in smoke shops and vape shops are high-potency cannabis products and synthetic cannabis products such as Delta-9, Delta-8, THCA, high THC products. And these have been linked in the medical literature already to psychosis. Is there a reason that this kind of well-established smoke shop problem is not something you're going after?
So I personally, in my writings as a physician, in my statements, and also the Department of Health and Human Services, have expressed serious concerns about people using these cannabis products. We don't want kids to use them. Cannabis use disorder is a real thing, and as you appropriately mentioned, there are now studies linking it to psychosis and even cardiovascular problems. So that is an entirely separate public health campaign, and it's an important issue. Thank you.
Okay, last question right here. Thank you. Amanda Seitz with the Associated Press. I was wondering if you could say what class you're recommending that it be scheduled and how quickly you're expecting the DEA to act.
Class 1, it is an opioid by definition. It will be ultimately up to the DEA to decide. Thank you.
Thank you so much.